morning, afternoon, evening, everyone. I'm really happy that you all could join me today for this special session on stopping Ebola through story and signal. Our three speakers who are with us today are Reverend Dr. Betty Kazadi Musau, who is the Director of Communications for the United Methodist Church in North Katanga, DR Congo, Judith Osanga Yanga, who's Director of Communications for the United Methodist Church in the East Congo Episcopal area of the United Methodist Church, and Joseph Kanyaki, who is Director of Communications for the Uganda Global Methodist Church. So I'm your host, Reverend Neely Hicks, and I'm the Executive Director of Harper Hill Global. Harper Hill is a nonprofit that focuses on using digital media and technology solutions to address humanitarian needs. We move through faith-based networks to address humanitarian concerns. We provide training and support for victims of trauma, emotional trauma, as well as empowerment initiatives for marginalized communities in Africa, Haiti, the Philippines, Europe, and the United States. Hold on. Since May 21st, we have deployed communication strategies to prevent Ebola in the DRC and on June 2nd in Uganda. These strategies are dependent upon people of faith and goodwill being willing to share evidence-based messages with those in their communities, those they love, those who they may not even know, but share these evidence-based messages with all who are near them. The ways that we get the messages out are through text, through WhatsApp, through television at times, and through radio. When we realized the grief and anger of communities who could not bury their loved ones who have died from Ebola, I turned to Ferdos Karas. And Ferdos Karas is one who I have turned to in the past to be able to help us get through stories, to be able to prevent disease and infection. I turned to Ferdos and to Artha Animation, who is his team of amazing animators in India. And together in record-breaking time, within 6 days, we were able to produce a story that highlights why we cannot bury loved ones who've died from Ebola and how we can recognize grief and recognize the anger of the people who are suffering so much. It's told through a pastoral lens, and so it is trauma-informed as well. This animation, along with 3 earlier ones, actually 2 earlier ones, have been transmitted since May 21st, and in Uganda and in the DR Congo. It's been submitted or shared through WhatsApp to vast groups of people within these religious networks, also reaching through the East Africa Great Lakes Initiative. I want to share a video with you now.
In outbreak settings, misinformation spreads faster than the virus itself. Harper Hill Global is reaching individuals in areas of high risk for Ebola with videos and communications containing life-saving information about how to stop the spread of Ebola during an outbreak, including hand washing and hygiene, as well as safe burial practices.
Let the goodbye be dignified. Let the living remain alive. Do not hide the death. Do not ask for the body. The last gift you can give your loved one is not touch. It is to protect everyone they loved.
The This informational video is being shared in 7 languages via WhatsApp, radio, and through churches sharing the message. We're equipping local leaders throughout the DR Congo and Uganda with the tools to stop Ebola before it spreads.
Se laver les mains régulièrement à l'eau propre, au savon ou à la cendre nous permet.
Together, we can reach communities with life-saving messages. Join us.
Okay, I'm going to go ahead and turn it over to Reverend Dr. Betty Kazadi Musau. As I said, she is from the North Katanga region of the DR Congo. Betty is a United Methodist elder who graduated from Africa University, completed her master's in gender and development, and completed a doctor of ministry in children and the globalized world with a semester on health and wholeness. She is passionate about public health because of personal experience, as she was caregiver to her mother who had suffered from a stroke. She has worn many hats for the North Katanga Episcopal area, including serving as Health Board Chair, Secretary of Higher Education Board, in North Katanga, Women's Ministry Strategist, Coordinator of Hypertension Program, College Teacher, and Director of Communication for Behavior Change. Welcome, Dr. Betty. I turn it over to you.
Thank you. Thank you so much for such, it looks very long introduction, eh? Thank you all for participating to this webinar. I'm a clergy from North Katanga Annual Conference. I am passionate in communicating for health. We have been coordinating the hypertension program in North Katanga, focused particularly on pregnant women and single mothers, with the help of Harper Hill Global, receiving different animation and content so that we share to different communities, especially remote areas in North Katanga. So far, it has been for almost 6 years that we have been doing that. And we are so grateful for the impact that we are trying to make in the community, especially in Kamina and the surrounding of Kamina. Looking at the role of the communication in healthcare, from my experience, the church is a key institution and a strong community presence, because it is truly a champion in the healthcare in North Katanga, because we are involved in programs like malaria prevention, maternal and infant care, hypertension management, and support of building of health facilities in our episcopal areas. As a church, because the church is both an institution and community where it reaches different people who are in the peripheries, people with low income, you really see that the church is present. That's the ministry of the Good Shepherd. It really plays a very vital role because of what it is, its vision and mission. And because of such an impact in the community, we really train our medical team to be supervisors of clinics in the very remote areas. Why? Because we have that vision of the ministry of presence. The presence creates relationships, fellowships. The presence creates the incarnation, where we are the body, the heart, and the mind. The presence creates the communal spirit, where we are together and we fellowship together. Besides, as a church, some of the time, after training medical teams, we always wonder, what is the motivation? Why do people serve in this area with a lot of challenges? The answer is rooted in values. We have three important values: love, well-being, and Ubuntu. Because all the work that as clergy and medical team are involved is driven by the desire to share health, to share well-being with others. Because the idea is very simple. I am healthy because you are healthy, and I want you to be healthy. With that mindset of Ubuntu, I am healthy because I want you to be healthy. Through those values, we are seeking for holistic well-being for everybody. That is why partnership is very, very important. We live from global to local, and we impact the community. That is why that's how you see the church is really influencing the behavior change. It's even impacting government officials to change their behavior. For the case of Ebola, we got different animation, the content about information. We use radio, social media. We have chat rooms, platforms where we share information on prevention. So we are continuing mobilizing people how to prevent Ebola, hand washing, and respect social distancing. This is very important. And before then, we train our medical team to be expert in those areas, especially in different villages. Why? Because of the three values that I've mentioned: love, well-being, and Ubuntu. I know that today, some people, when they watch TV, they speak of resistance from people, misinformation, but the role of the church. I speak as a church, but the role of the church is to dismiss misinformation, because life is sacred. And as a church, we play a very unique, important role to be relational, to be incarnational, and to be community-centered, so that there is behavior change. And we dismiss the idea of witchcraft, we dismiss the idea of poison, and we dismiss really the idea of resistance among people. Because before we speak of a resilient community, it is very important to train, educate people. When they understand, they become knowledgeable, and they will assume their responsibility and be resilient indeed. That is why, as a church, we are really committed, and we are continuing till today. We are continuing to use the radio where radio is available, and where TV is not available, we continue to use the radio. We continue to use our weekly meetings to pass on the message in the community for behavior change. I think that's what I want to share with you. Thank you for listening.
Thank you so much, Dr. Betty. I appreciate the power in your voice, what you are able to do through words, the fortitude, the forcefulness that you exert, this voice of truth for so many. I do want to mention that if you have questions, you can post those in the chat, and we will have time for Q&A towards the latter part of this session. For now, I want to turn it over to Judith Osongo Yanga, and I'm going to just share her bio here on the screen. It's quite a bit to read, and I'm mindful of time, but I will be also providing each of you with the slide deck so that you can read more afterward. Judith, I'd like to go ahead and ask you to speak.
Thank you very much. My name is Judith Osongo Yanga. I am the Director of Communication for the East Congo Episcopal Area. working with the United Methodist Church. I start my work in East Congo. I start my work in East Congo as a communicator, and also the church helped me to have many training in communication, so that's why I continue to work on it, and I receive the call, the call from my God to work for the population in difficulty area. And today I have this honor to share with you what I learned about humanitarian communication. You know that in East Congo, a part of our several episcopal area is now in a crisis of Ebola. And the disease of Ebola, if you can hear from the radio, from the network, they are talking about the specific of this kind of Ebola. It is called Bundibugyo. And this case of Bundibugyo is a case what we don't have no medicine, we don't have no vaccine. But in the remote area, people can say that it is not a disease, but it can be a political issue that we put in collaboration with the health board, so that they can send the disease to the population. The politician want to kill us. You know, that was the first misinformation through our population. And so as a communicator, as an humanitarian communicator, we need to have the good information and to share it on time. That's why we use, with the support of the Harper Hill Global, we try first as a church, as a United Methodist Church, we try to send some message to the community leaders in at Bunia, the province of Ituri, at North and South Kivu. We try to send a message to awareness the population about the disease, because they want to know exactly what's the problem. And when they have when they have a misinformation, you know, we can have more people who pass away because of the misinformation. And we use our time as communicator to work on it, and it was very hard, but by the grace of God, we do the best of ourselves. I remember when I start to share with someone in Bunya about what we need to do. Sometimes they say that no, we need just to have our time to think in our community on how we can see this disease. But today we try to have some video, some audio in local language, because population in the remote area, they don't know English, they don't know French. Sometimes they don't know Swahili or Lingala as the language in Congo. But we try with Harper Hill Global, we try to translate those video and audio to their local language, to their mother language, maybe Hema and the Lendu. And today they have those audio on the radio, because we try to have a meeting with 5 radio stations from Bunya, and we conclude the project with them that we need to share the awareness to the population, because Ebola is a reality. Ebola is not something demoniac. Ebola is a reality. Ebola is not a politic problem, but we need to see what we can help population to understand that and to accept that Ebola is a disease. And when they have some suspect case of someone who have a hard fever, they can immediately send the person to the health center. That's why we try to do our best, how we can be close to them. We can see what they need to have in this meeting with the community leaders. And we try to give some solution. As an humanitarian, we try to give a solution. That way we send this audio and now we can play it in the local church. We play it in the local church. We show the pastor after his preaching. He took 10 minutes for preach and 10 minutes for share and awareness the member of his local church about the Ebola disease. So it was a good surprise for us because, you know, as a pastor, Mama Betty is there. He is a pastor. When you call to a pastor to say that we need to have 10 minutes from your speech, it is not easy. But the pastor was the first to take this message and share with the population in the local church. That's what, as a communicator, we are working close to the United Methodist Church to help and to save life. Because as a communicator, we are here to look for the good information, to look for the very nice information and send it on time. That's what we use for this time, to use the audio so that they can have this audio and share in their family. One of the leaders from this area at Bunya shared with us a testimony. He said that I am a director of my community tribes. So he said that he will take this video and audio and share with the member when they have their meeting at the end of the month. For us, it's a good testimony because, you know, when a leader have a message and share with the population, it's very, very important, and all of us we will take it in consideration. So the very important medication for now about Bundibugyo Ebola disease, it is only the awareness. We need to prevent the population. We need to use the prevention because we have no medicine, we have no vaccine. And when we talk with the population in this area, what we do is to have those population to understand that the Ebola disease, the Ebola Bundibugyo, has no medicine. And now they understand. For the first time, they did not accept the community health to go to the area there where we have Ebola, but now they accept the board health to be there and to help them. And when they have some cases of person who pass away, they accept to leave the person to say that we gave this we gave this to the board health to go and bury the person. That was our work as a communicator, to be close to the population, to share information with them, to say to them that we love you so much. And the one who passed away, if he was on life, he cannot accept you to be like this. And we need also to work with other radios in the same area, to work with radio at Bunya and at Goma and Bukavu. We are started our work there to work with them so that we can also share the same audio and the same video to those population so that they can be out of the Ebola disease. Because Ebola is a reality. As the Bible say, you know, the Bible say that my people perish for lack of knowledge. So the people, they want to have information. They have to have the knowledge about the disease. They want to understand what exactly Ebola. They want to understand how can I prevent my family, my husband, my kids from Ebola. And when you are close to those people, you can hear what exactly the need of the population. And for us in the communication, we say that the first need is to have information. That's why we share information with them. You don't have information, that is a lack of knowledge. If you don't have this information, it's like you have a a lack of knowledge that we received to a member from this local church at Bunya. He called me to say that, as the Bible said, it's now I see that it's real, it's a reality, because sometimes we can see, the message from the social media go very fast, and quickly the information is shared. But as a communicator, we need to have a plan of how we can work with the local community, with the people who have no internet, they have no Android, they have only the small phone that they can just send a message. And also they have no those telephone, but they can use the radio to hear the message every times, perhaps 2 times a day, in the morning and before they go to sleep. That was some of the strategy that we use with the radio community, to say that our video and audio cannot pass during the day. We can use it here in the morning, because when someone is awake, he can hear from the radio to have some information. We send this message, we send the video and the audio. And at the evening, before sleep, sometimes we need to hear information in the area. That's why we use with the community. And now every year we have those information, but on Saturday and Sunday, we have it in the local language. We have it in Ilendu, we have it in Hema. But some people from the Bira ask us if we can have it. I know that by the grace of God, we can also have it. It will help them to go out to this disease. But that's why I was, that what of some of the information I want to share with you as a communicator, as an humanitarian, and because we receive feedback from Bunya, we can say that we have done very well our work. But because we have feedback from them, that was very important for us to share with you. Then when we have some disease, we cannot be quiet. We must talk with people. We must go to those people to hear what they need. That's why we say, all together, let us stop Ebola. Because Ebola is a reality. Ebola is not a demoniac. Let's protect our life. Let's communicate with the prevention information for everyone. May the Lord be with you. May God give us a wisdom to understand what we can do to go to those people and share information. Because as communicator, we are ambassadors, and we need to save life through communication. Thank you.
Thank you so much, Judith. I really appreciate the work that you're doing there. It's a joy to work with you, and I just know that we can do even more to prevent this deadly disease. Next, I want to go to Joseph Kanyike, and I'm going to share a slide like I did for Judith so that you can see his bio. And Joseph is the Director of Communications of the Global Methodist Church in Uganda. And I will again share the bios with you after the conference is over. But Joseph, I want to go ahead and turn it to you for you to provide us with an update on what is happening there on the ground in Uganda.
Once again, good afternoon, everyone. My name is Joseph Kanyike, Director of Communications for the Uganda Annual Conference of the Global Methodist Church. It is such a privilege to join you today as we discuss how trusted communication, faith-based partnerships, and community engagements are helping to prevent the spread of Ebola in Uganda and the Democratic Republic of Congo. As of today, Uganda continues to maintain a strong response to the Ebola outbreak linked to Bundibujo strain originating from the DRC Congo. Uganda has recorded 19 confirmed cases for the period when the outbreak started. However, yesterday, after a period of 16 days, 20th person was recorded. And sadly, we have lost 2 people, and these were Congolese nationals. Encouragingly, if you look at for the last 16 days, there was no case being reported. And of course, that demonstrated the effectiveness of rapid surveillance, contact tracing, community engagement, and coordinated public health action. Meanwhile, I know our friends have not talked about it, but as you are very much aware, news reports are confirming about 1,000, actually more. Today I was checking, and there are more, like 1,000 confirmed cases of Ebola in the DRC Congo, and more than 250 reported deaths. So that is so absurd. The threat of cross-border transmission remains real. So even if you are in Europe or in America, Ebola does not know borders. We need to work as a team to make sure that we conquer the threat of cross-border transmission. And even when you are far away, probably if there are systems that are set, as we are very much aware of how countries are trying as much as possible to close their borders, the threat of transmission to border communities is real. And we happen to see the transmission along the border, day to day. So much of those that are reported to have contracted Ebola, many of the people are within the border communities. Uganda's success has not been achieved through enforcement alone. You may hear that, the border was closed between Uganda and DRC, but it has come through trusted community engagement, rapid response systems, border screening, contact tracing, and constant public awareness campaigns, and partnerships that place accurate information directly into the hands of ordinary people. This is where the partnership between Harper Hill Global and Global Methodist Church in Uganda has become especially important. Together, we have developed a rapid response communication strategy designed to reach people quickly with life-saving Ebola prevention information. Through SMS messaging, WhatsApp distribution networks, community outreach, and church communication systems, we are sharing accurate prevention messages throughout our country. Working with Harper Hill Global, we have developed and translated animated Ebola prevention videos into multiple languages. We have English, which is commonly used in Uganda. We also have Luganda, which is used mostly in towns, but much more within Kampala, which is the capital city of Uganda. Then we have Atesot, then Lugubara, then Lunyankole, and then Kiswahili. These are culturally relevant, materials which help to ensure that people receive information in languages they understand and trust. Recognizing that many vulnerable communities have limited resources and access to technology, Harper Hill Global has also helped advocate for and provide us with educational tools. We have a projector, we have a screen, we have a laptop and a solar-powered equipment. These mobile learning platforms allow us to bring prevention education directly into remote villages, refugee settlements, churches, schools, and border communities. In addition, Harper Hill Global has partnered with the church in Uganda to mobilize critical prevention and hygiene resources, including hand washing cans, water jerrycans, liquid soap, sanitizers, gloves, sprayers, temperature screening equipment. These practical tools reinforce health messages being delivered and strengthen community resilience. Many communities along the Uganda DRC border have experienced significant economic hardships due to movement restrictions and reduced cross-border trade. And recognizing these, plans are underway to support some of the affected border and refugee communities with targeted food assistance and community support initiatives. What makes this approach unique is that it empowers local faith leaders and community communicators to become trusted public health messengers by equipping churches and interfaith networks with evidence-based information, training, and communication tools. We are helping to create what Harper Hill Global calls a blanket of protection across vulnerable communities. The lesson from this outbreak, my dear friends, is that information saves life. I'll repeat this. The lesson from this outbreak, my dear friends, is very, very clear. Information saves life. When communities receive timely, accurate, culturally appropriate information from trusted local voices, they are empowered to protect themselves, their families, and their neighbors. On behalf of the Global Methodist Church in Uganda, I extend sincere gratitude to Harper Hill Global and all of us, the partners, faith leaders from Uganda, DRC Congo, and the entire Connection Network, our donors and volunteers who continue to stand with vulnerable communities during this critical time. Together, through faith, partnership, innovation, and community engagement, we can stop Ebola. And let's strengthen resilience for future public health challenges. Ebola does not know border. Ebola can reach you wherever you are. We need to act and act now to stop it. Thank you so much. May God bless you.
Thank you so much, Joseph. This is the power of communications. Humanity has never lived at a point like we are in today, where we have the ability to reach people with accurate information across the globe because of the phone, because of the internet, because of all of the different technologies that we have at hand. And so we really want to highlight the ways that we can use these technologies for good. There was one other person that I wanted to speak, but we are running short on time. George, I think it would be valuable if you would just share just a couple of minutes about what it's like living at the border in Uganda.
Thank you, everybody, and a greeting to everybody.
Thank you.
I want to appreciate being part of this important meeting. I want to reintroduce myself again. I am George Cunnington Orochi, staying in Ebi district, in West Nile part of Uganda, and it is bordering the Democratic Republic of Congo. We are just near to the border, just like 15 kilometers from where I stay to the border. I work as the director of an organization called Intersanctuary Organizations for Development Initiatives Limited, Uganda. The organizations really mobilize, organize, and also empowers community in the areas of addressing health issues, addressing trauma stress issues, addressing poverty issues, addressing climate change and environment issues, and the education issues that affect their growth and well-being. In addition to being the director, I'm also a trainer, community trainer of trainers, especially in the field of trauma and stress. This capacity I gained it from the series of training which had been organized by Harper Hill Global, led by Mama Reverend Nili. Then I am also a part-time worker at the border. That is, I work as a trade information desk at Goli border, which is just 15 kilometers from my home, my residence in Nebi town. I want to appreciate the four presenters. Their presentations have been so good, but let me go to my presentation as well, a brief one. As I said, I live at the border.
Excuse me, George.
Yes.
Just a time check. We have just a short amount of time. So if you could just focus on what is happening at the border and your experience of that as it pertains to Ebola. Thank you.
Oh, okay. What is happening at the border is that the threats of spread or transmission of Ebola is real following the declarations of the Ebola presence or outbreak in Uganda. And in this response, the border community are not safe because of the interactions between the people between the two countries. Because there is movement of interactions of people in the two countries and also inland. Now, what is happening at the border is that there are a lot of interventions taking place which have been being conducted by the government of Uganda, by the international community, by the organizations, both international, national, and local, and also in communities, especially the preventive measures which are in place. For example, as Joseph said, currently there's border closure, the movement of the people is restricted, especially those coming, the local community, coming in from the DRC to Uganda and from Uganda to DRC. Local community movement has been restricted or is stopped, but the movement of the truck drivers, long distance drivers who carry goods into the country, both of the country is taking place, but they go through a lot of undergoing screening to see that they are Ebola free. So that is taking place. The border closure is there as one measure of preventing the spread of Ebola from DRC to Uganda and likewise. Then in addition to that, there is also hand washing facilities which are in place where people are encouraged and motivated, those who stay within the border, and the truck drivers, the health workers who cross the borders are being encouraged to wash their hands regularly, and also the community regularly. And there is also posters where displayed in public places, at the borders, in markets, in churches, in the trading centers, in order for people to read and see what the information, the right information about Ebola, the prevention, the control, the management is taking place at the border.
Thank you,
also,
George.
there is awareness creations, sensitizations on radio is taking place. Then also, as the organizations, intersanctuary organizations for development initiative, together with the Harper Hill Global, we are in partnerships. We are sensitizing the people. We have received video animations from Harper Hill Global. We are using it. We share it into our different network of platforms, like the WhatsApp platform, to the people, where they can be able to view.
Excuse me, George.
Yes, please.
Yes, thank you so much. We have a shortage of time and we need to get to questions in the chat. So I appreciate this report from you, and I'm going to include your full report on the website as well as in the follow-up email to all of our guests. So we have a question from Lachlan Faro for Betty, Judith, and Joseph. The question is, how can people in NGOs like Harper Hill Global, but also the WHO, the Africa CDC, and others understand what tools you need that are most useful to educate your communities in ways that lead to behavior change? Two, ensure that you have those tools and forms that are most useful. And three, support you in being able to use those tools most effectively and share them with others as widely as possible, including other faith networks. So I do want to say that everything that you've asked, Lachlan, this is the work of Harper Hill Global. And I want to provide an invitation. Harper Hill Global is a small entity. We're a small NGO. And everything that we're doing right now is based on donations from people who give anything from $25 to $2,500. Dr. Betty, would you please add information about working with other faith traditions? I've been to Camina a few times, and I remember so fondly how the imam in Camina said that in Camina, Muslims and Methodists are one. Could you speak to working with other religions?
Yes, please. When the government, the Ministry of Health, announced the outbreak of Ebola at the local level, that means at the level of North Katanga, there was a meeting organized by health coordinator, inviting the population to share the information about the outbreak. And in that information, they targeted church leaders. That means faith-based organization leaders to come and listen to what the Methodist Church is sharing like information, because where we live, some of the time we get ahead of information to share in the community to other faith-based organizations. The outbreak does not know any race, any tribe, any denomination. It is a disease, and people should be preventive. Locally, what we did is like we invited all faith-based organizations to share about the information. So, like Pentecostal churches, Muslims, we have them in Camina. So they got this information because soon, with the help of support from Global Health, they will be sharing hand wash.
Thank you, Dr. Betty. You are now on mute. I do want to thank you both for adding to the conversation about working with others. I believe that some of the programs, hold on, some of the churches are part of interfaith coalitions. And that was extremely powerful in Sierra Leone, where Bishop Yambasu, God rest his soul, he worked with an interfaith coalition to stop Ebola, and everyone was included, from, as they call, the witch doctors on up to different religions, indigenous religions, Muslim, Catholic, Pentecostal, Methodist, all groups came together, because he said that if they did not all address Ebola with the same message, that they would never be able to survive as a country. So in closing, I want to highlight where you can get the animation. And Also to remind you that this is not the only animation, the burial animation is not the only one that's out there. Ferdo's Caress has a big library of animations, and he has them on Vimeo so that they are easy to download. So if you scan that QR code on your screen, you'll be able to download videos from there. Also, I want to just invite you to keep the programs of Harper Hill Global in mind for partnerships. We would love to work with other organizations, also for giving. As I said before, everything is coming in from $25 to $2,500 and up. And these gifts are what help us feel the resounding love of community, no matter the size of the gift. It helps us feel supported, and every dollar counts. Every dollar will go towards the programs that you've heard today. And together we can save lives. I want to thank you for coming, and please watch out for a follow-up email from me where you'll be able to see the video, and you'll also be able to receive other detailed information. Thank you so much. I pray that God blesses your heart, and with God blesses all those you love, and that God enlarges your heart to love more. Thank you for coming.
Thank you too. Goodbye, everybody.
Yeah.